Soy Anival Moreno, tengo 50 años y tuve un accidente con un tráiler, nos chocó a mí y a mi compañero.
Ese día pues fue muy triste.
Pues lo único que recuerdo es cuando llegó el helicóptero.
The pre-hospital providers actually were dead on when they called us. They said they're really worried about that. He has a flail chest, which means one side of his rib cage is completely crumpled. And they gave us all that information ahead of time. When he got here, he arrived, he was in bad shape. We worked him up, resuscitated him, fully imaged him, and found that he had several life-threatening injuries, including a blunt aortic transection of the thoracic aorta, a flail chest on the right side, or multiple rib fractures, severe, and a bad pelvis fracture.
Pues fue algo muy fuerte para mí. Gracias a Dios me dejaron entrar con él. Al entrar yo ahí, al verlo, ¿verdad? Pues pelaba sus ojos, me apretaba las manos despidiéndose porque él decía que ya iba a morir. Esa misma noche lo mandaron a ICU. El siguiente día, que fue el miércoles, se le hizo la cirugía de la arteria aorta.
We actually did this case in a cardiovascular OR, and we had the entire CV surgery team ready at the bedside as well with a perfusionist. We didn't need to do that, but we just have it there as backup because this is the first case that was done like this at our hospital.
Since we have everything set up in the right time and the right fashion, we proceed and perform the placement of the stents. And there was probably 20 minutes procedure with good outcome.
It wasn't a rush job, but it's a job that you have to do quickly.
Using wires, we placed an endovascular stent, similar to what you would place small stents when patients have a heart attack and they put small stents in, but this is a large stent that goes in the aorta. The reason it's tricky in the thoracic aorta is because it's high up where some of your major blood vessels are that come off, for instance, the vessels that feed your arm. And we've done a lot of those here, but we had never done it for this type of condition before.
Se hizo la cirugía de la pelvis y luego la de las costillas. Las costillas tuvo que ser mucho después porque él traía un problema en el pulmón derecho. Entonces necesitaban estar seguros, ¿verdad?, de que el pulmón se desinflamara bien y él pudiera respirar por sí mismo.
As a Level 1 trauma center, we now have the capability to manage much more complex injuries. I don't think this was possible down here in the Rio Grande Valley prior to DHR becoming a Level 1 trauma center, but we've made significant improvements in the quality of care and the number and the complexity of procedures we can perform now.
Sí, cuando él entró a rehabilitación, tuvo varias terapistas, terapista ocupacional, física, ¿verdad? Y el de recreación, muy buen personal.
Mr. Moreno was treated by the trauma surgeons and medically and surgically stabilized, and he was transferred out to us in the inpatient rehabilitation for continuity of care. He did wonderful here. He was not bearing any weight on one of the legs, but he walked out of here with the family and with the recommendations of continuity of care as an outpatient.
O sea, estamos bien agradecidos con todos los cirujanos, con todo el personal de DHR Health por todas sus atenciones, ¿verdad? Se portaron muy bien, siempre estuvieron al pendiente de nosotros, ¿verdad? Porque de mí también. Y pues la prueba aquí está, ¿verdad? Que él está bien.
Okay, for you to be a Level 1 trauma, you need to be able to have all devices and other ancillary products to get people through their traumatic events.
We're just so grateful that from pre-hospital all the way through back home, even with having all those severe things, a severe pelvic fracture, an aortic transection, a flail chest, even with all that, we were able to do all of his care right here in the Rio Grande Valley and not send him out hundreds of miles away from his family, costing him and the system hundreds of thousands of dollars for the transfer. And so we're just so proud and so grateful that we were able to help patients like him every day.
Que estoy muy agradecido con lo que hicieron conmigo y que Dios los bendiga.